Hello, today we will be discussing on how to set up our patient for a PA colon. First, we will need to do our patient preparation, which includes introducing ourselves to the patient, stating that we are going to be taking their images today, and ask the patient for their full name and date of birth, while also checking on the patient's wristband to ensure that we have the right patient. For our female patients, we will need to ask them about their last menstrual period. The image receptor size for this image should be a 14 by 17 cassette. The image receptor orientation should be in portrait mode, and the image receptor location should be at the table bucky. The SID for this image should be approximately 40 inches or 100 centimeters. Patient position should be that the patient should be positioned in the prone position with a support for the head for comfort. Our part position for this would be that we would need to align the MSP to the midline of the table and ensure that there is no body rotation. The central ray location for the image should be at the center of the IR and to have the central ray at the level of the iliac crest. The central ray angulation for this should be perpendicular to the image receptor. Our collimated field size for this image should be full collimation of the IR, which would be approximately 14 by 17 inch collimation. The visual of appropriate marker location would be that the marker should be placed in the pelvis area, particularly on the femoral head. The KVP range for our real patients would be approximately 110 to 125 kVp. And the instructions to the patient for the exposure would be that to inform our patient to stay still, we would be exposing on the expiration. So we would ask our patient to take a big breath in, blow all the air out, and stop breathing. The anatomy demonstrated in the image would be the entire large intestines, including the left celiac flexure. The items in profile will include the large intestine and both the hepatic and the splenic flexure. The pathology best demonstrated in this image would be obstructions such as ileus, volvulus, and intussusception. That would include how to position our patient for a PA colon or a PA barium enema.